Welcome to Queensland X-Ray. We're pleased you've chosen to come to us for an MRI scan of your heart, called a Cardiac MRI scan. At Queensland X-Ray, we have a team of specialty-trained healthcare professionals with extensive experience in performing cardiac MRI studies. Our Cardiac Imaging Centre is based at the Mater Hospital in Brisbane, where we have the most advanced cardiac imaging equipment available today. Through a research partnership with Siemens Healthcare, we ensure the very latest technical developments are incorporated into our everyday practice. Before you arrive for your appointment, our team will have reviewed your clinical history and symptoms and planned your examination to ensure we get all the information needed by your specialist to manage your care. Cardiac MRI scans provide a lot of information about your heart and the way it is working. To acquire this information takes a long time. It's advisable to allow up to 2 hours for your examination. The success of your MRI scan depends a lot on you, so please take a few minutes to learn about what will happen during your scan. When you arrive at Queensland X-Ray, we'll ask you to complete an MRI safety questionnaire to make sure you don't have any medical implants, devices, or medical conditions that may put you at risk. You'll need to change into hospital pyjamas to ensure there's no metal on your body or in your clothing. Your belongings will be placed in a locker for safekeeping. Once changed, you'll be taken into the MRI preparation area, where our team will explain your procedure and get you ready for your scan. First, we will place some ECG dots on your chest. The quality of your cardiac MRI scan depends a lot on your heart rhythm and on the ECG recording we get. For best results, we use a special abrasive gel to prepare your skin. Sometimes, men may need to be shaved so that we get the best possible skin contact. For most cardiac MRI scans, we'll need to give you a small injection of an MRI contrast dye into a vein in your arm so that we can get more detailed information about your heart tissue. The MRI contrast we use is considered to be the safest available on the market today. You are now ready to go into the MRI room for your scan. Cardiac MRIs don't hurt, but you do need to be able to lie flat on the table for about an hour. Our specialist radiographers will make you as comfortable as possible, and it's important that you don't move on the table once we start the scans. Once you are in position on the table, we will attach ECG leads to your chest. This captures your heart rhythm so that we can coordinate taking the images with the beating of your heart. We will then place a pad on your chest which works like an antenna to capture pictures of your heart. This is not heavy, but it may make you feel a bit warm during the scan. The MRI scanner has a fan with cool air and also lighting inside to make you comfortable. Our scanner has the widest bore available and is wide open at both ends. MRI machines are very loud when the images are being taken. To protect your hearing, we'll give you earbuds and headphones. Through the headphones, you'll be able to listen to music of your choice and also hear the radiographer talking to you. We'll also give you a buzzer so you can let us know if something is wrong during the scan. Rest assured, a radiographer is watching you at all times and will be talking to you often, even though we are not in the same room. Cardiac MRI is one of the most complicated imaging studies to perform. All our technical staff have undertaken specialty training and know exactly how to get the best pictures specific to your anatomy, your heart rhythm, and your breath-holding ability. While the images are being taken and during rest times, the radiographer is planning your next scans. Each separate scan is planned specific to you while you are on the table. This is why it is important you don't move during the scan. During the MRI scan, you will need to hold your breath while we take the pictures. The length of the breath hold depends on your heart rate, but is usually around 10 to 15 seconds. This is one of the most important parts of the examination, and we'll work with you to make sure you understand the breathing instructions. This way, we make sure we get the clearest pictures possible. While the scan is taking place, our doctors will also be reviewing the images and making sure we have all the information we need. Once all the scans are taken, you'll be free to get changed, check out at reception and head home. But our work is not yet complete. Our Cardiac MRI team will analyse the images to obtain detailed data about the structure and function of your heart. This can take anywhere up to an hour. Once the workup is finalised, our specialist cardiac imaging doctors will write a comprehensive diagnostic report that will be sent to your referring doctor. At Queensland X-Ray, all our doctors have undertaken specialty training in cardiac MRI and maintain an expert level of clinical and technical knowledge in the field of cardiac imaging. Queensland X-Ray is proud of our world-class cardiac MRI service, and we look forward to welcoming you into our practice. For further information, please visit our website at qldxray.com.au.